If you've been diagnosed with axial spondyloarthritis, or you suspect you might have it, here's what you need to know about treatment, because there is a lot more available now than there used to be. And it starts with one conversation with your GP. Axial SpA is a manageable condition. It is chronic, yes, but with the right treatment, many people live full, active lives. The key is getting the right diagnosis and the right specialists involved early. So let's walk through how treatment actually works. The first line of treatment for axial SpA is non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, things like ibuprofen or naproxen. And here's something really interesting. A good response to NSAIDs is actually one of the diagnostic clues that your back pain might be inflammatory rather than mechanical. If your pain genuinely melts away with anti-inflammatories in a way it never does with paracetamol or rest, then that is worth making a mental note of and telling your doctor. Please be aware though that NSAIDs don't modify the disease, they manage symptoms, and not everyone can take them long term. So if 2 different NSAIDs have been tried and they're not giving adequate control, that's when the pathway then moves on. Step 2 is biologics, otherwise known as TNF inhibitors. If NSAIDs haven't worked well enough, the next step is biologics. And one day I'll actually pronounce that well, with anti-TNF agents as the first choice. These are medications that target a specific inflammatory protein in the body called tumour necrosis factor, which is driving the inflammation in axial SpA. These are given by injection or infusion and have transformed outcomes for many people with this condition. Step 3 is IL-17 inhibitors and JAK, spelled JAK, inhibitors. If anti-TNF treatment isn't suitable or stops working, there are further options. IL-17 inhibitors like secukinumab and JAK inhibitors like upadacitinib are now NICE approved pathways for axial SpA in the UK. JAK inhibitors work differently. They target inflammatory signalling pathways inside cells, and they've been particularly important for patients who haven't responded adequately to biologics or who've lost response to them over time. And this is really exciting progress when it comes to medications. A condition that once had very limited options now has a real treatment ladder with multiple routes. And step 4-ish is the stuff that runs alongside everything. So non-pharmacological strategies are considered essential throughout, as opposed to optional extras. That's exercise, movement, manual therapy, physiotherapy, chiropractic care, not necessarily chiropractic adjustments. Keeping the spine mobile is not just helpful, it is part of the clinical management of axial SpA. And this is where practitioners like me and my team come in, working alongside your rheumatology team. So what do you actually do next? So you can't self-refer to rheumatology. You need a GP referral. So if anything I've described in this series resonates, the inflammatory pattern of pain, the morning stiffness, waking up at night in pain, it improves when you start moving, write it all down, make a symptom diary. I'm a massive fan of symptom diaries. All of it, stick it all in. Take it to your GP and ask specifically, could this be axial spondyloarthritis? And can you refer me to rheumatology? You may well need to advocate for yourself quite strongly, particularly if you are a woman, as we talked about in the last video, because this condition has historically been missed in women. But treatments exist, the pathway exists, and if you're suffering, you deserve to be on it. Like, follow, subscribe, do all the things, and share this with anyone who's been struggling with unexplained back pain for years, because it might just be the video that changes things for them.